Hello, my name is Jordan. I'm a nursing student at the University of Michigan and I'm going to present a patient. Patient background. Patient is a single 17-year-old Caucasian female who is currently a high school senior enlisting in the United States Army. Vital signs. Patient's vital signs are normal. Her heart rate is 67 beats per minute. Her respirations are 14 per minute. Her temperature is 36.7 degrees Celsius. Her blood pressure is 122/78, and her oxygen saturation is 98% room air. She is 5 feet 6 inches and weighs 152 pounds. Her usual source of medical care is her primary care physician or the emergency department when her symptoms become unbearable. Reason for seeking care. Patient's chief complaint upon admission is sharp stabbing pain in the chest, accompanied by pain in the neck, left shoulder, and left arm, as well as a feeling of lightheadedness attributed to atrial septal defect. History of present illness. Patient's pain symptoms due to atrial septal defect began about 8 years earlier and was officially diagnosed about 3 years ago. However, she has had the defect her entire life. It is unknown what factors caused her initial symptoms. Patient's symptoms are chronic and have become more severe over time. She currently rates her pain as a 7 out of 10 and states that there are no aggravating factors or alleviating factors except for admission to the emergency department at her local hospital for treatment. And a precipitating factor for the symptoms is being at rest or being asleep. She states that the pain interferes with her daily activities because it often wakes her up from sleep, increasing her overall fatigue, and when the pain won't subside, frequent trips to the emergency department interfere with her school attendance and sports practices. History of present illness continued. Patient states that associated symptoms include sharp pain accompanied by a feeling of faintness, and pain is mostly felt in the heart, left arm, shoulder blade, axilla, and neck. Patient feels angry when symptoms are present. She perceives the problem as difficult to deal with due to missing out on things that she enjoys doing, such as sports. She also states that it is taxing to keep up with missed school and homework while she is absent for doctor's appointments, and states that she is unable to enlist in the Army until her defect has been repaired and she has recovered from the procedure. However, patient has recently met with her cardiologist and scheduled an appointment for cardiac catheterization to repair her atrial septal defect. Health history. Patient's history of childhood illness includes pneumonia before the age of 1 and tonsillitis, which has occurred annually throughout childhood. Patient's history of chronic or serious illnesses include atrial septal defect, vocal cord dysfunction, which also began about 8 years ago, mood disorder, which was diagnosed this past year, and attention deficit disorder, which was also diagnosed this past year. Immunizations are up to date. Patient has no known allergies or reactions to drugs. Hospitalizations include various emergency department visits for atrial septal defect and vocal cord dysfunction throughout childhood. Patient has no surgical history but is scheduled to have surgery to repair the atrial septal defect later this year. Patient takes 200 milligrams of Advil orally as needed, as well as 3 milliliters of albuterol via inhalation with a nebulizer as needed. Functional assessment. Patient denies drug use and is a non-smoker. However, she drinks alcohol occasionally. Patient waitlists 1 to 2 hours Monday through Friday, attends sports practices 2 hours Monday through Friday, and does cardio 1 hour daily, and sleeps 7 hours a night. Patient reports good nutrition and no caffeine intake, and always wears a seatbelt while traveling in the car. Psychosocial data. Patient lives with her mother, stepfather, and younger brother in Stanton, Michigan. She states that she often argues with her mother in recent months, however, that her mother, stepfather, siblings, and close friends are her biggest support system. Patient states that her stressors include school, bullying occurring at school, Army enlistment, and arguments with her parents. She reports no known environmental health hazards. Patient is Christian. Her education level is a senior in high school, however, she is expected to graduate in June 2017. Patient sees primary care physician as needed, cardiologist monthly, speech and respiratory therapist regularly, and is seen in the emergency department if she is experiencing unbearable pain. Family history. Patient's mother suffers from migraines due to a car accident in 2001 and experienced heart palpitations during third pregnancy. Her maternal grandmother suffers from chronic UTIs, TIAs, and pneumonia. She is a 2-time breast cancer survivor, and she had a stent placed in her heart after a heart attack in 2011. Patient's father struggles with his short-term memory after a brain injury from a car accident in 2001. Her paternal grandmother died of ovarian cancer at age 43. Review of systems. Patient describes her general health as satisfactory, however, she wishes she were in better physical shape. Weight and energy are stable, however, the patient recently lost 23 pounds during training for the Army over a span of 4 months. She reports no fevers, chills, or night sweats, however, she does report excessive fatigue. Her fatigue doesn't usually interfere with ADLs, however, she tends to oversleep occasionally. Patient reports no heat or cold intolerance. Due to a complaint of chest pain, patient's cardiovascular system was reviewed. Patient reports sharp stabbing pain in chest, however, frequency, duration, and intensity vary with each experience. She also reports left arm numbness as felt in the dorsal portion of the arm as well as the antecubital fossa and states that numbness is felt almost constantly. She reports a history of congenital heart disease as well as a faint murmur due to the atrial septal defect. Patient reports no change in exertion tolerance, however, she reports extreme fatigue and is only able to walk medium distances before having to stop because her heart rate increases. Stairs and hills intensify the distress. Patient reports no issues lying flat and only uses one pillow. She reports frequent heart palpitations. Due to a complaint of pain and numbness in the left arm, the patient's peripheral vascular system was reviewed. Patient reports no pain in the lower extremities while walking. She also states no edema, coolness, or hair loss of the extremities present. Patient reports no history of blood clots in legs and no varicosities. Physical examination of the cardiovascular system. Upon inspection of the patient's chest of the aortic, pulmonic, Erb's point, tricuspid, and mitral areas, there were no heaves, lifts, or thrills present. The contour of the patient's chest is normal and she has no concavities or signs of barrel chest. No lifts or thrills noticed during palpitation of the aortic, pulmonic, Erb's point, tricuspid, and mitral areas. Patient's PMI was normal, 2 centimeters in width, and had a 2+ pulse. The aortic, pulmonic, Erb's point, tricuspid, mitral, and apical areas were auscultated with both bell and diaphragm of the stethoscope, with the patient in a sitting and supine position. Rate and rhythm of heart sounded normal upon auscultation. Extra heart sounds and murmurs were auscultated in the left lateral position with the bell of the stethoscope. However, no extra heart sounds or murmurs were heard, although patient states having a previous diagnosis of a faint murmur. Physical examination of the peripheral vascular system. The color of the patient's lower extremities is normal, no erythema or cyanosis present. Patient has no body hair distribution on legs because she shaves. No varicosities, edema, or ulcers present. Patient's pulse was measured and found to be normal and have a regular rate and rhythm and graded as 2+. Skin is of expected warmth, no varicosities, tenderness, or edema present. Capillary refill was 2 seconds or less in fingers and toes. Pertinent systems, respiratory. According to Martins and Wald, 2014, a symptom of atrial septal defect is pulmonary hypertension, though it is not common in younger children diagnosed with ASD. However, based on this symptom and the patient's history of vocal cord dysfunction, the respiratory system is an important one to be considered for assessment. According to the patient, she has been hospitalized many times for symptoms such as chest pain or ineffective breathing due to atrial septal defect and vocal cord dysfunction. The patient states that her vocal cords will spasm and close her airway, in which a steroid is needed for bronchodilation to reopen the airway. Pertinent systems, neurological. According to Eubanks 2010, arm pain and numbness can be caused by compression of a cervical nerve root. The patient states that she feels pain and numbness in her left arm, making this a potential explanation. A neurological assessment may be important to ensure the nerves are functioning properly. This assessment will confirm that the patient has normal sensory function, as well as rule out any signs of stroke or nerve or injury or damage. This assessment is also pertinent due to the patient being an athlete, as she injures herself more than the average person.